Bloodborne Pathogens, a safety meeting video brought to you by weeklysafety.com. Let's begin. Bloodborne pathogens are infectious microorganisms found in blood and certain bodily fluids that can cause disease. Exposure can happen in many situations, including when providing first aid. If a coworker is injured, you may need to step in and help, and it is important for everyone that you know how to do it safely. This safety meeting covers how exposure happens and what you can do to protect yourself. Understanding risk. The most common bloodborne pathogens include Hepatitis B, Hepatitis C, and the human immunodeficiency virus, also known as HIV. These pathogens can enter the body through cuts, abrasions, punctures, or through the eyes, nose, or mouth. Exposure does not require a major incident. A small cut on your hand, combined with contact from infected blood or fluids, is enough to create a risk. This is why awareness and preparation are critical any time you may be assisting someone who is injured. How exposure happens. Exposure to bloodborne pathogens can occur two ways. Direct contact happens when infected blood or fluid enters your body through an opening or sensitive area. Indirect contact happens when a contaminated object, such as a needle or soiled gauze, transfers the infection. Common situations include handling sharp objects, cleaning up after an incident, or assisting someone with an open wound. These types of exposures can happen quickly, and without proper precautions, you may not realize the risk until it has already occurred. Universal precautions. The most effective way to reduce risk is to follow universal precautions. This means treating all blood and bodily fluids as if they are infectious, regardless of the situation or the person involved. This approach removes guesswork. You do not need to determine whether something is safe. You always assume it is not safe and take the appropriate protective steps every time. Personal protection. When providing first aid or responding to an incident, personal protective equipment plays a key role. Disposable gloves should always be worn when there is a possibility of contact with blood or bodily fluids. Additional protection, such as safety glasses, a face mask, or barriers, may be necessary depending on the situation. Avoid touching your face, especially your eyes, nose, and mouth, while providing care. Once the task is complete, remove gloves carefully to avoid contact with the contaminated surface and dispose of them properly. Hand washing is one of the most important steps. Wash your hands thoroughly after removing gloves or after any potential exposure. Sharps and contaminated items. Sharps include items like needles, but they can also include broken glass, razors, or any object capable of puncturing the skin. These items must be handled with extreme care. Never pick up sharps with unprotected hands. Dispose of them immediately in designated containers. Leaving sharps unsecured creates a serious hazard for anyone in the area. Other contaminated items, such as gauze or cleanup materials, should be handled carefully and disposed of in the appropriate containers. Cleaning and decontamination. After any exposure to blood or bodily fluids, all affected surfaces, tools, and equipment must be cleaned and decontaminated. This includes floors, work areas, and any items used during the response. Some pathogens can survive outside the body for extended periods. Hepatitis B can remain infectious in dried blood for up to a week, and Hepatitis C can survive for several days. This is why proper cleaning is not optional. It is a necessary step to prevent further exposure. After exposure. If you believe you have been exposed to bloodborne pathogens, act immediately. Wash any affected skin thoroughly with soap and water. If blood or fluids come into contact with your eyes, flush them with clean water for an extended period. Report the incident and seek follow-up care as soon as possible. Early action can make a significant difference in managing potential exposure. Key takeaways. Bloodborne pathogens are a hazard anytime there is contact with blood or bodily fluids. Treat every exposure as potentially infectious, use proper protection, and follow safe first aid and cleanup procedures. Quick, informed action makes a difference. Thank you for your time and attention during this safety meeting. Don't hesitate to help, but protect yourself first.